House Democrats are demanding answers from the Trump administration over its targeting of the Affordable Care Act in court. Several House chairmen, including Judiciary Chairman Jerry Nadler, wrote letters to the White House, Department of Health and Human Services, and Department of Justice. They asked for documents related to the administration's decision to end support for Obamacare. The Trump administration said late last month it wants to strike down the entire health care law. Here's Congressman Nadler from earlier today.
But now, under President Trump, the Justice Department, which has a solemn duty to defend and enforce acts of Congress, is proving to be the biggest threat to health care coverage for millions. In the span of 2 years, the department has substantially shifted its enforcement of the ACA from defending it in court to arguing the individual mandate was unconstitutional and so pre-existing condition protections must be invalidated, to now stating that the entire law must fall.
Attorney General William Barr testified on Capitol Hill today. When asked about the law, he said to, quote, let the courts do their job to determine if it should stand. Republicans have argued the Affordable Care Act makes coverage too expensive and puts too much of a burden on taxpayers. But the noise over the Affordable Care Act might be overshadowing the real issues surrounding health care. Politico executive health care editor Joanne Kenen writes about it in her recent article, Obamacare Fight Obscures America's Real Health Care Crisis, Money. And Joanne joins us now from Washington. Joanne, thank you so much for being with us. Great article. You write about how the partisan battles over Obamacare are not taking into consideration the true cost of health care for families. Outline for us, if you will, what the Democratic and Republican strategies are for fixing health care.
Well, they're far apart, and we spend so much time fighting about Obamacare. You know, people like me who cover this, who cover health care, we spend a disproportionate amount of our time fighting about Obamacare, and that's what Congress is fighting about. But we're spending $3.7 trillion a year on health, and that's a whole lot of money. And neither party is really coming to terms with it because we're fighting about Obamacare. I'm not saying there are not some legitimate issues to fight about Obamacare, but it's not the entire American healthcare system. The Democrats right now are focused on trying to improve Obamacare. They have put forth a bill in the House that would expand subsidies and stabilize the markets in the states. That would bring down premiums, they would hope. But that's using tax dollars. That's not dealing with the underlying costs of what we're that $3.7 trillion. Republicans are trying to come up with, they couldn't repeal Obamacare, as we all know, so now they're fighting it in court, and they're also fighting it on the regulatory front. They're allowing a lot of plans out there, health plans, that are not compliant with Obamacare. They're cheaper, but they also don't provide as much insurance. So they're basically, and they're going to be sort of fine if you're young and healthy. That shifts costs to people who are older and sicker. Again, it doesn't really address, it may help certain individuals, it may harm other individuals. It's not getting at that $3.7 trillion, which is basically a fifth of our economy.
So the underlying problem then is the pricing is so extreme, but isn't it a little bit of a catch-22? I mean, hospitals and doctors and the healthcare industry have to charge so much for those who can pay and those who are insured because so many people who use these services can't pay. Isn't that what the problem is?
It's not just that. It's that we spend more money than every other country, and our outcomes aren't better. We're not really doing the best health care in the world. We do some things great. I mean, if I needed a liver transplant, I'd probably want to do it in the United States. If I wanted my diabetes managed, I might not want to do it in the United States. We just spend a ton of money. No other advanced European country which has really good health care actually spends that money. So it's not just the cost of covering the uninsured. It's the price of our health care. It's the intensity of our health care. You're right. It is also costing some of the some of this cost shift when we're covering the uninsured, but it's not just the cost of covering uninsured. It's pretty much everything is, we don't coordinate care well. We pay doctors for quantity of care instead of quantity of care. Excuse me, the quantity of care instead of the quality, although we're beginning to address that and shift that. I mean, you go to the doctor, this doctor doesn't talk to that doctor. Things are duplicated. If you've had a parent or a grandparent who's sick, you really see how much duplication and inefficiency and lack of quality there is in many cases.
There have been some efforts to change all of this. Tennessee Republican Senator Lamar Alexander has been trying to refocus the debate on lowering costs. There have also been some bipartisan efforts to cut down on drug prices and limit what you call surprise medical bills that really cut into family budgets. But you write that this isn't enough to improve health care. What needs to be done?
Lamar Alexander is actually trying to do a sort of, big meta attempt on health care. He said you can't bring down the price of health insurance unless you just bring down the price of health care. And he's been out there trying to get a lot of ideas about how to attack these underlying costs that I've been referring to, how to really deal with the system and the waste in the system and the overuse and the high prices and everything else. So he's actually making an effort. I've been in Washington for 20 years, so I have, in fact, seen other efforts. We don't know whether it'll get anywhere. He's asking questions that are important questions. These other questions about surprise bills, which is like you're hurt, you go to the emergency room, you go to you have surgery, you go to an in-network hospital, you do everything right, you're insured, you're paying your premiums, you're staying in network, and lo and behold, you end up with a doctor who's still out of network, and you get this surprise bill. Maybe nowadays not such a surprise. Not a lot you can do about it, even if you're a pretty informed and responsible patient trying to keep within your system. It's not that that won't help. It will help. It will help anyone who gets those bills, and it might bring down some of the prices that, some of the surgeons or emergency room physicians are charging. It's not going to fundamentally change the overall trajectory of spending a fifth of our economy on health care. Same thing with drug costs. There are some bipartisan issues, bipartisan efforts. Lamar Alexander is one of the people, both Republican and Chuck Grassley, Republican, and a lot of the Democrats do want to do something about drug prices. But A, are they going to succeed legislatively? Will they agree? And how far can they go? Compromise. There's going to have to be compromise because Republicans and Democrats don't agree on all the steps. They do agree on some, but that's not. So it's not that it won't help people or it won't make a difference, but it's not going to, really solve this mega problem we have of spending a fifth of our GDP on health care.
It seems like there are so many entrenched special interests also that at the end of the day, someone is going to have to be a loser so that the, average American consumer can be a winner. And it's up to Congress to figure out who that's going to be.
And the K Street lobbies, all the healthcare lobbies are quite powerful on K Street, and they're already gearing up for 2020 to protect their turf. They're gearing up big time.
They're ready.
So yeah, if you want to lower prices, somebody makes less money.
Right.
I mean, that's why it's so hard. That's why Lamar Alexander, that's why I think those of us watching him make the effort, we also know what he's up against. The people aren't really talking about slashing prices. Some people are, but a lot of the economists would talk about lowering the rate of growth so that we're not cutting what the doctor makes tomorrow.
Right.
Maybe as we're cutting what he's going to make in 10 years, that he'll make a little bit more, but not double it.
A more efficient system would help everyone. All right, Joanne Kenen, thank you so much for your insight.